Hello everyone, welcome back to our channel. I'm Dr. Amel from City Skin Clinic, and today I'm going to chat to you about jawline Botox. This is also known as jaw slimming Botox, Masseter Botox, and tooth grinding Botox. And as we'll kind of discuss, it's a treatment for all of these things, and a lot of the patients we see either are doing it for one purpose or more commonly a combination. Without further delay, let's start with what the anatomy and the physiology behind jawline Botox treatment is. So you have several muscles that are responsible for chewing or mastication. And one set of these muscles is the masseters. And actually, if you put your hand over here and you clench down, you can actually feel them as you clench and then relax when you stop clenching. So these muscles, along with other muscles in the jawline and the temporalis muscles over here, which again, if you clench your teeth, you can feel it contract, are responsible for chewing, and that's a really important function. However, if they become overdeveloped, they can cause a few things. So one of them is people who suffer from tooth grinding. It's often associated with stress and anxiety, and one of the things that happens is these muscles are overactive, and people often tooth grind and clench their muscles. Is something that's usually subconscious, and it happens more often than not at night, and that can lead to pain in the jawline, tension here. It can lead to temporomandibular joint dysfunction, so kind of wearing down and inflammation of the joint here, and it can also obviously lead to grinding down or wearing down of the teeth. So it's a horrible, painful condition, and the treatment can range. So as well as obviously trying to deal with the cause of the stress or the anxiety, people often go and see a dentist for this. They might get splints for the teeth, guards. But jawline Botox is also a really, really effective treatment for this. It helps relax the muscles here so that you are not clenching all the time, and it does often, in many cases, also help with stopping teeth grinding, so that you can also work in the background on the cause of the stress as a more long-term solution. The other thing that happens is when these muscles become overactive, overdeveloped, it can lead to a squaring or widening of the jaw. So another reason we perform this treatment is when people want to reduce the squaring or reduce the wide appearance of their jaw to make a better balance with their face. And so injections that kind of relax the masseters here will also do this, and that leads to a more oval shaped or more V-shaped streamlined jaw. And the two things aren't mutually exclusive. We do find that when people have overdeveloped masseters, that can lead to a change in the appearance of the lower face, but also it can lead to stress or tension or tooth grinding. So usually people have this treatment for two reasons, but it's also something that we do for just jaw slimming as well. The treatment itself, it's again highly personal. We always, our doctors feel out the borders of the muscle, because what you want to do is reduce the masseters and kind of relax them, but you don't want to affect the other muscles around the jaw, which are also needed for chewing. You know, you want to relax the masseters, but you don't want to stop being able to chew completely. So we then place targeted injections, a series of them, into the belly of the muscles. They're not painful. We put numbing cream in. And then with any Botox treatment, it takes a few days to work, and we generally say the treatment reaches its peak in this area at about the 3-week mark. And then at 3 weeks, we bring people in for review at the 3 or 4 week mark. And then if there's still more activity than desired, we top it up. For some people that's necessary. Other people, straight away the treatment works and the muscle fully relaxes and they don't need a top up of their Botox. So again, it's a very highly personalized approach. What can you expect after you've had the treatment? Well, On the initial day, really nothing. You've just had the injection. Some people feel a little relief, usually because the saline has been injected into the muscle, and that might just cause a little bit of relaxation. But actually, for the Botox to start working, it starts after a few days, and each day you might just start to initially find that your jaw's tired. That's what some people say. So when you're chewing something like steak or something that needs a lot of effort, initially you might find this takes a little bit more effort. And then as the muscle relaxes, people start to feel less tension in their jaw. They notice that there's a reduction in tooth grinding. If you're someone who clenches a lot and you've got pain in these areas, you might start to notice there's a reduction in pain as well. So it's a really nice treatment. It's a treatment that I also have because I'm someone who gets quite stressed quite a lot, and a lot of that stress carries around here. And it's just something that, again, it's a very personal choice. If you are getting this treatment purely for tooth grinding, just be aware that a side effect of that, or an additional effect, is that by slimming the muscle, if it's really overdeveloped, your face may change a little bit, i.e. it may just become a little bit slimmer. Most people are quite happy with this, but some people might not like it, and in that case you might consider other treatments like having splints or guards. If you are someone who's purely getting it, you don't have tooth grinding or any problem other than you want to kind of have a more oval or V shape to the lower face, then that's great, but just be aware that you may end up finding it, I wouldn't say hard, but it may take a bit more effort to do. If you're someone who's big on eating steak and really chewy kind of tough things, you might find initially anyway, it feels a little bit, it takes more of an effort to do that. You're more aware that you're needing to chew because you've, again, relaxed this muscle. But if, for most people, that's not a problem either way, but it's just something to have, kind of to bear in mind. And then this treatment, it's great and it lasts about 3 to 4 months. Some people a little bit less, some people a little bit more, but we generally say in the 3 to 4 month mark. And you will know once the Botox wears off. If it's for tooth grinding, you might notice that you're going back to doing that. If it's for square jaw reduction, you might notice that your jaw is looking less slender than it used to. And that's, I'd say, a good time to sort of, once you start noticing that, it's a good time to come back and have the treatment done. If you decide that you no longer need the treatment, or you don't want it or whatever, there's no harm. Once the Botox wears off, like anywhere else on the face, it just wears off and you're not left worse or better off than before. It's as if you didn't have it. So again, when done correctly, these are really good treatments. It's always important with everything to be aware of the benefits, but also the limitations, the potential side effects, and that's why it's really important with this treatment. If it's not done correctly, if the injections aren't in the right place, people can end up having asymmetry of the smile, they can end up having the difficulty chewing anything at all. So again, it's worth taking some time. It's not a matter of just banging in an injection around here anywhere. If you want to find out a little bit more about this treatment, I'm going to leave links to the relevant page on our website, and please feel free to leave a comment below if you want to know anything about this treatment or anything else. Before I go, please, if you enjoy our content, and we're going to be producing a lot more in the coming days, just hit the notification button and subscribe to our channel so you'll know whenever our new videos are out, and don't forget to give a thumbs up to this video. Bye.